Welcome to TED Congress 2024 here at Scottsdale, Arizona. I have the distinct pleasure of having Dr. Krishna Jain here. He is a vascular surgeon and is attending the Congress. Krishna, welcome.
Thank you very much. Thanks for inviting me.
Yeah. So what I've seen over the years, and we've gone back a long time, is the shift of cardiovascular procedures to the outpatient. Whether it be an office-based lab or an ambulatory surgery center. I think you were one of the first few people to recognize the importance of doing these procedures. Why did this happen?
We were very fortunate to start our lab in 2007. A lot of 2005 Reduction Act by the government gave us the opportunity to do procedures in the office. So it was so hard to get cases done in the hospital. We used to spend an hour and a half having coffee between cases. So when the shift came to the office, we started doing more and more cases. As the more codes became available in the office to be done, we started with the dialysis work, then we started lower extremity revascularization. So the efficiency is so much greater and the results are comparable or sometimes better than the hospital system. So we see no reason that the patients that can be done in outpatient in a safe environment should be done in the hospital.
Excellent. I think you were one of the pioneers to move these cardiovascular procedures to the outpatient. The other thing I've noticed in your whole career, which you've done a lot, is the establishment of wound care centers, limb salvage procedures, and these taking this whole setup to the outpatient with more personalized care. How did that happen?
Also, that happened because I was helping my friends open endovascular centers in the office because I thought that's what they should, that's the right thing to do. So I approached a wound care company. I said, I know all about the flow. You guys know all about the toe. So look at the toe and flow model. You know the wound care. I'm not an expert in wound care, but you guys are. So the CEO of that company came to my center, saw the center, but they were owned by private equity and they decided not to do it. But there were some people in that organization who left the organization who used to own their own wound care company. So they said, Krishna, this is what we want to do. So I knew, again, as I said, perfusion, they knew about the wound care. So we merged the two specialties, so to speak. So now our passion is to create outpatient limb preservation centers, which includes endovascular labs, whether it be in the OBL or an ASC, plus a freestanding wound care center, make them work together.
Excellent. It has to be a multidisciplinary approach to save limbs and save lives.
Oh, absolutely. I actually talk about 4 pillars of limb preservation. Pillar number 1 is medical management. If your diabetes is not controlled, blood pressure is not controlled, you don't exercise, nothing will happen. The second pillar is perfusion. The third pillar is the wound care. And the fourth pillar is managing your neuropathy. If you go in the history of limb preservation, it all started with neuropathy, actually, which came from leprosy. Yeah, so there's a huge history about me creating these 4 pillars.
Yeah. Excellent, Krishna. Thank you so much for being here and participating. It's a pleasure to have you. You've done a lot for the vascular community and vascular disease in general. Your passion for limb salvage is tremendous, and I hope to see you again next year at the TED Congress 2025.
Thank you for inviting me, and I'll be there.
Thank you.